You are listening to the Final Say Radio Show, a Rappaport Media production, with your host Brett Rappaport and co-host John Rappaport.
I want to introduce to the Final Say Radio program, we have Congressman John Fleming. He was from the 4th District of Louisiana, and he just had a press conference yesterday promoting the Healthcare Conscience Rights Act. It's a fabulous act. By the way, this bill is only 12 pages. It's not a couple thousand pages long. It very simply, in 12 pages, with a little historical background, addresses a problem. And this is fantastic. Congressman, welcome.
Well, Brett, John, thanks for having me. And let me comment to say that in Washington, there's an inverse relationship between how good a bill is and the size of it.
So, looking at this bill, the obvious issue here is that the Obamacare, if we will, bill, the Affordable Care Act, along with the rollout of, probably, 10,000 pages at least of regulation so far? The rollout
I think
of all this, I'm sorry.
Yeah, it's probably well into the tens of thousands. Before it's over, it'll probably be 100,000 pages.
That's worse than our tax code, so that's very scary.
Yeah.
So when we look at this bill, you're addressing the infringements upon the religious rights of American citizens.
Yes. We have had since Roe v. Wade the Hyde Amendment and the Hyde-Weldon Amendments, which have pretty much provided for protection against taxpayer funding for abortions. And also there's been long-standing traditions of protecting healthcare workers, organizations such as Catholic institutions, and certainly private businesses that may provide some sort of coverage for their employees, customers, may provide direct care services, that they should not ever be forced to do things against their own conscience. And that's provided for in the First Amendment to the Constitution, which provides for freedom of speech and freedom of religious expression. And part of that, of course, is to say that if I'm opposed to abortions and I'm a doctor or a nurse, I shouldn't be coerced by any law or certainly my employer to participate in anything that would violate that conscience. So with the passage of Obamacare, and you may recall that in 2010, during the debate, that there was controversy over certain protections and provisions of taxpayer funding of abortions and conscience rights, and the president promised an executive order to provide those protections in order to get it passed. And, of course, the rest is history. That was all lip service. Those conscience rights protections are not included in Obamacare. And so now you have a dam with a lot of holes in it that are leaking when it comes to protections for conscience rights. So Congressman Black, Fortenberry, and myself, Diana Black, a lady from Tennessee, Jeff Fortenberry, and myself, have 3 different bills which we've put together as one bill, the Healthcare Conscience Rights Act, which we're talking about today.
No, and I just want to point out something, and this act in the very beginning, in point 2, talks about the historical, in the, referring to some of the past acts and beliefs of Jefferson himself, that in other acts it's been codified to take care of these serious issues. When we look at the Public Health Service Act, the United States Leadership Against HIV/AIDS, Tuberculosis and Malaria Act, the Religious Freedom Restoration Act. So this isn't anything new, but certainly it's new the way this administration has gone about not addressing the issue.
Absolutely. Basically reinterpreting the law, suggesting that now that government has taken over healthcare delivery at one level or another, comprehensively in the case of Obamacare, that it can also begin to dictate what is moral and what isn't moral when it comes to that, so as to say that, for instance, a doctor or a nurse can be fired if they don't participate with providing abortifacients, which are pills that could generate an abortion. or in the case of a Catholic clinic or hospital, that they could be fined for refusal to provide sterilization procedures or birth control, which of course is against their religious beliefs. So these are all things that we've taken for granted as Americans that are now really under attack.
You know, Congressman, one of the things that I find particularly frustrating is the duplicity with which the left applies their logic, right? So, and I'll give you an example of that, right? Here you have, there's so much contempt. Anytime religion, the tenets of the religion, the same things they like to pontificate about when they're being sworn into office, if in any way some of those religious beliefs tends to cross paths with the day-to-day living preferences, whatever those may be, of people, they scream bloody murder. But then they have absolutely no trouble trampling, as you pointed out, on the foundational tenets of the religions to begin with. And you have to make the difference. These are not churches that are saying specifically what other people can do. They're basically saying you can't tell us what to do with our bodies in our house of God. Yeah,
absolutely. These are long-held, deeply held moral beliefs that have been protected that really go back to the founding of this nation. I mean, most of our ancestors came here for religious freedom, to get away from a state-run, state-operated, or state-controlled religious organization or denomination. And in fact, what's happening is those rights, those freedoms are being rapidly eroded such that a government can put a business such as Hobby Lobby, for instance, completely out of business by fining them into bankruptcy for not doing precisely what the government tells them to do, even though it violates their deeply held beliefs on religious grounds. So, the left is all about telling us what we can eat, what we can put into our bodies, what health care is going to cost, what doctors we can see. They're all about doing that. But then when it comes to actually protecting us in our beliefs and who we can, or at least what certain methods of treatments and things that they want us to provide, but we ourselves as healthcare workers, or certainly because I am a physician, or as an employer, the coercion of us in what we do and what we have to deliver both to patients and to our employees is just outrageous and unprecedented.
Well, exactly. If you can't protect my borders, which is what I need you to do, I don't need you to try to protect me from what I might choose to put in my mouth. Congressman, I have a quick question for you. So one of the great frustrations, and we've discussed this as a group, when a lot of people don't realize there's a tremendous number of very experienced doctors in Congress, and the White House and the folks behind Obamacare did little, if any, consultation when they were crafting this bill in the first place, and we've talked about that numerous times on the show. Since then, have they done any outreach at all, or are basically you guys still being left out of the conversation and not being consulted?
We were never consulted, and you're right. The real brain trust in terms of healthcare workers, doctors, clinical psychologists, nurses, all of these groups that were right there in the House of Representatives and a couple of doctors in the Senate. Remember, the president said that he would meet with any member of Congress, go over it line by line. Well, we reached out to him a number of times, never received any response, not even a single email. And now that, again, this is being implemented, there are all sorts of problems. They're way off schedule in implementing Obamacare, and they've yet to reach out to us or to respond to us. So I would say not only are they poorly responsive, they're absolutely avoiding us at every pass. And so everything about Obamacare has been created by non-healthcare workers from everything we can determine. And even the IPAP, the Independent Board Advisory Board, which is a 15-member group that will be appointed by the president to decide what health care gets paid and how much is going to be paid and who it's paid for, which is really the beginnings of rationing. As far as we know, there's not even a necessity to put a physician or a health care worker on that, and certainly these people are not going to be required to answer if you decide to phone them to complain.
Well, everybody in our listening audience knows how frustrating it is to try to get response from any government agency as a general rule, right? It's a black hole. You know, cooperation with governors seems to me to be one of the possible avenues that you could take now, right? Because if you assume that you guys have already been held in contempt, so as has at least half of the American people and the Constitution, the governors are the guys who are now stuck trying to determine how to implement this, and you know there's a lot of frustration on that side. Has Congress, and in particular yourself and the other doctors who've had at least made a valiant attempt to have a voice behind this, have you been able to in any way work with the Governors Association to sort of fight against Obamacare?
Well, you know, we've been in communication. For instance, my governor is Bobby Jindal in Louisiana, and we've talked with him periodically. You know, he's chosen, with this, at least the state government, which is led by him, have decided not to implement the expansion of Medicaid. I support that. We can get into that, but the bottom line is that's a disaster to expand Medicaid in order to provide for Obamacare. Number two, they've chosen not to, at least in about 50% of states, chosen not to open up state exchanges, which again I think is a very wise move on their part, which will require the federal government to do it in their place. And I think there's all sorts of wise decisions being made there. So I would say that about half of states are being well run today. That is to say, they're not going along with Obamacare. They're doing things to reform the work laws in their states, reducing regulations, reducing taxes. And these states are successful. Unemployment levels are going down. But if you look at other states like California and Illinois that are going along with Washington and the excessive spending and regulations and taxes, and the state of Massachusetts, which of course has an Obamacare-like program already, where you're seeing the most expensive per capita health care in the country and the longest waiting lines to see doctors in the country, you see what's successful and what's failing. So we're working with the governors, and I think the governors are ready, just as we are, to pounce upon the opportunities once Obamacare begins to collapse under its own bureaucratic weight, to begin to dismantle it, reform it, and even repeal it, and bring in the kind of patient-responsive, patient-centered sort of health care where the decisions are being made with doctors and patients in the exam room where they belong.
Congressman, I'm so glad that you said that, because we've had many discussions with several of your doctor colleagues there, and it has to be the relationship between the patient and the doctor that comes before any other consideration. And I think that the health care bill almost completely ignored that fact.
No doubt about that. Well, look, the bottom line is there are only two ways to control health care cost. One way is to put all the decisions in the hands of government, which means that government has only the option to ration care, right, because it can't afford to have an open-ended checkbook for health care demand, because as humans we'll demand more and more until the government runs out of money. So that's the model Canada and Great Britain has used. And of course their hospitals are filthy. They give mediocre care, and people are very unhappy with it. On the other hand, what's traditionally worked here, although not perfect and could be improved tremendously, has been, again, to engage the patient in the healthcare cost discussion, where the patient can sit with a doctor in the exam room and say, you know, doc, this is going to cost me some money, maybe just deductibles and co-payments, but I'm going to participate in this, and I want to know what it costs, and I want you to justify for me these tests that you're ordering. Are they worth the money? And, in fact, are they potentially dangerous to me? That's the kind of discussion doctors have had in this country for years, and it's worked beautifully. It's only when government has begun to take over that decision making? Have we begun to see costs spiral out of control and more and more difficulty delivering that? And as a result, what's really coming, and that's a tsunami of lack of access to patient care, which will grow across the country, not just with the lower income Americans, but even upper middle class Americans will find themselves more and more unable to find a doctor who will see them and accept their card.
No, that's absolutely right. And I just want to bring up a couple issues here that I think were lost in the conversation. One would be tort reform. I know that the administration has addressed to some degree the fraud in Medicare and Medicaid, but I think that the excessive billing by insurance companies or by by doctors or facilities, hospitals, whatnot, to the insurance companies or to the federal government, I think that a lot of the problem lays there. And in fact, I always thought this. The same thing applies to our tax code. If everybody has a little bit of skin in the game and has to pay some tax, then you have a little more appreciation of what you're receiving for it. And I think if you go to the doctor and you have to at the very least pay, it could be $10, it could be $20, it could be $40, whatever the amount is, at least you're paying something. You realize that there's a cost to going to the doctor, and maybe it limits you to only going when you really need to.
Well, absolutely. And really we have a beautiful system that developed about 15 years ago that really handles that well, and we implemented in my small business but before I even came to Congress. It's called health savings accounts.
Yes.
And it works very simply. You get to save money up pre-tax in an account that you can use as deductibles and co-payments, but it's your money, and you're going to watch that like a hawk. And so it doesn't mean that you've got to come even out of pocket. It doesn't mean that in some way you're going to be drained of funds, because it's really interesting human behavior. Even though you've got plenty of money that's set aside just for your health care cost, when it's your money in your account, you're going to be very, very watchful of that. And Obamacare doesn't do that. In fact, it really reduces the impact of health savings accounts. And so it works like this, and this is why you have fraud, waste, and abuse. Look, if somebody along the way decides you need a walker or a wheelchair or a motorized vehicle, whether you need it or not, if it doesn't cost you a dime, who are you to say that you don't need it or want it? And as a result, it gets billed. You don't care. You're not going to complain because there's no money out of your pocket. But it drives up the cost in the system as a whole tremendously. And then when it's, again, time for you to see a doctor and maybe have a hip replacement or something like that along the way, well, government decides that, look, we don't have enough money for everybody to have a hip replacement, and we're going to be putting you on a waiting list, and we're going to push people in front of you who are healthier and more productive. That's really the way socialized medicine works.
That's absolutely right. Congressman, how could our listeners or anyone who follows our program get in touch with your office and help support you on this bill?
Great. Appreciate you asking that. The best place to start is my website, fleming.house.gov, Fleming, .house, HOUSE.gov, G-O-V. And from there you can connect with my Facebook, Twitter, email us, call us, whatever you want to do. And I do post on Facebook, and I do respond to questions on Facebook. And we get into all of these things deep into the weeds, and also at the 50,000-foot level. And you can find on my website more information about the kind of positive solutions that we have, the House Republicans, where we really bring health care back to the patient and to the doctor in the exam room, reasonable solutions, cost-effective solutions, and ones that I think are going to be necessary for us going forward after we dismantle and finally repeal Obamacare.
Well, that's fantastic. And I have to say we bring on Congressman Phil Rowe and Congressman Paul Brown, and Diane Black has been on the program many times as well. And we always enjoy speaking to all of you. I think you guys do a great service, and you really represent the American people well, and we appreciate that. And just wanted to share that.
Sure, thank you. They're all doing a great job and good friends of mine, so I appreciate you having us on.
Thank you. You have a wonderful weekend, and hope to have you back soon.
Will do. Thank you.
Bye.
All right.
Again, that's Congressman John Fleming. You can go to fleming.house.gov, and he is the congressman from the 4th District of Louisiana.